Welcome to the Liver Transplant Patient Education class. This class was designed to help you learn more about the liver and the liver transplant process. Please write down any questions you may have so that your nurse coordinator can answer them for you appropriately. We invite you to be fully engaged during this class. Please take this time to silence your cell phone. If you need help doing so, please ask for assistance. In a healthy adult, the liver is the largest solid organ in the human body, weighs approximately 3 pounds, and is about the size of a football. It is located on the right side of the abdomen and is protected by the rib cage. A healthy liver is smooth, and blood is able to flow through it easily. Your liver helps fight infections and cleans your blood. It also helps digest food and stores a form of sugar that your body uses for energy. What causes liver disease? There are many different causes of liver disease or liver failure. Infection, such as a virus like hepatitis B or C, alcohol abuse, NASH, also known as fatty liver disease, which may be caused by diabetes, obesity, or malnutrition. Cryptogenic, which means we don't know the cause. Genetic or hereditary diseases, such as Wilson's disease or autoimmune hepatitis. Bile duct disease, such as PBC or PSC. Hepatocellular carcinoma, or liver cancer. Patients with cirrhosis are at higher risk to develop liver cancer. It is very important to have yearly radiology scans, such as a CT scan or MRI, and an ultrasound of the abdomen every 6 months as surveillance for liver cancer, so that treatment may be started as soon as possible. Signs that your liver may be failing include feeling very tired or fatigued, buildup of fluid in your belly or ascites, edema or swelling, forgetfulness or confusion, known as encephalopathy, yellowing of the skin or the eyes, called jaundice, tendency to bruise and bleed easily, bleeding in the stomach, esophagus, or intestines, called varices, generalized itching. The most common reason for needing a liver transplant is cirrhosis, which is irreversible. Cirrhosis is scarring of the liver. When the liver is scarred, it shrinks and hardens. You may also need a transplant if you have a risk of dying from your liver disease, or if your liver disease is impacting your quality of life. There is no suitable replacement for a failing liver like there is with kidney failure and dialysis. Doctors will determine whether a liver transplant is the best treatment option for you. Some of the many benefits of transplant include increased life expectancy, improved quality of life, and regained sense of independence. Please note that transplantation is a treatment option and will not necessarily cure the underlying cause of liver failure. Today you'll hear about the MELD score, which stands for Model for End-Stage Liver Disease. It is a scoring system that is used for prioritizing candidates on the liver transplant waiting list. The score is based on a statistical formula designed to predict who needs a liver transplant most urgently. It is calculated by a formula using particular lab values. The MELD score ranges from 6 to 40. A MELD of 6 indicates the liver is functioning properly. The higher the score, the higher the chance a person will die from their liver disease without a transplant. Today, after this education class, you may be asked to complete a 6-minute walk test and a short physical performance battery test to help determine your current functional status. If your results are poor or you're unable to complete the test, you may need rehabilitation services or lung testing. You will meet your transplant coordinator and review your medical history. You will talk with the transplant surgeon to determine if you should be evaluated for transplant. You will likely have lab tests to include drug, alcohol, hepatitis, and HIV screening. Suitability for an evaluation and transplant is based on criteria that will be discussed today. If it is determined that you should be evaluated for transplant, you will go through a series of tests and consults, which may include meeting with a social worker to review your social support and, in some cases, psychological testing, dental screening, radiology testing of the liver and the lungs, tuberculosis screening and vaccine updates, pulmonary or lung testing, cardiac workup or heart testing, kidney testing. You'll have a consultation with a hepatologist, which is a liver specialist, nutrition consultation, colonoscopy. If you need assistance with filling out your advance directive and living will, we can set you up with a life care consult. Females will need to have a mammogram and pap smear or pelvic exam. Males over 40 will have a PSA drawn, which is a lab test that tests the prostate. It is important to understand that the majority of the evaluation is required to be done in San Antonio and will be scheduled over approximately 3 to 4 days. Our transplant center does not offer assistance for transportation or lodging. If you have concerns about expenses, time, or travel, please notify your coordinator in advance to avoid canceling or rescheduling. Compliance is a huge factor in determining if you're a good candidate for transplant. We will observe your compliance throughout the transplant process, including abstinence for drugs and alcohol, your willingness to complete the evaluation in a timely manner, and your continued compliance after transplant listing, such as keeping your clinic appointments in San Antonio, following the proper diet, and taking your medications as prescribed. Patients with advanced liver disease or patients with underlying kidney disease may require a combined liver-kidney transplant. These patients will be listed for both organs and are usually offered both at the time of transplant. In rare instances, only one organ will be offered, and the patient will remain on the list for the other organ until another offer becomes available. If it is determined that you should be evaluated for combined liver-kidney transplant, your coordinator will also schedule a nephrology consult and an ultrasound of your kidneys as part of your transplant evaluation. Priority on the transplant list for a combined liver-kidney organ transplant will depend on the MELD score. The higher the MELD score, the higher the priority for transplant. Patients on the liver-kidney transplant list will require updates with the MELD score as well as the PRA. If transplant is in your future, you're not alone. Our transplant team is here to support you and help you through the process. Each patient is assigned a specific transplant coordinator who will be your primary point of contact for anything related to transplant until you're transplanted. We have hepatologists or liver specialists, transplant surgeons, social workers, financial coordinators, pharmacists, psychiatrists, discharge nurses, clinic staff, OR team, dietitian. We also work closely with your primary care physician and your primary gastroenterologist, so it is very important that you continue follow-up care with them. We also work closely with you, your family, and friends. The Transplant Selection Committee, which includes transplant surgeons, hepatologists, nurse coordinators, social workers, dietitians, radiologists, and our procurement team, meets routinely several times a month. Every patient's case is discussed at this meeting, at which time their evaluation results are reviewed to determine whether a patient can be placed on the waiting list or if there are any issues which need to be further addressed before a patient can be placed on the liver or combined liver transplant waiting list. You will be notified in writing of the committee's decision. 3 potential decisions may be made. The patient meets the criteria and is approved to be listed. The patient does not meet the criteria and cannot be listed. Or more information is needed to make a determination, and the decision is deferred until further information can be obtained. Some patients cannot be evaluated or listed for a liver transplant if there are any of the following findings: HIV, cancer occurring outside of the liver, advanced heart or lung disease, uncontrolled infection in the body, active drinking or substance abuse. University Transplant Center has a strict 6 months abstinence policy. You will be randomly tested for drugs and alcohol, even if your primary disease is not related to drugs or alcohol. If at any time your drug or alcohol tests are positive, we will automatically stop the transplant evaluation. If you're listed, you will be placed on hold. If you're approved for listing, your evaluation results will then be sent into your insurance company for transplant surgery approval. After your insurance approval is obtained, your coordinator will contact you and ask that you have blood work drawn to calculate your MELD score and be placed on the waiting list. Once you have been placed on the transplant waiting list, you will be notified in 2 ways. Your coordinator will telephone you and send you a notification letter by mail. United Network for Organ Sharing is a private, nonprofit organization that is under contract by the federal government. It manages the national transplant waiting list, matches donors to recipients, and monitors every organ match and transplant to ensure patients receive healthy organs as they become available. During your transplant evaluation and once you're listed, you have the following rights. You have the right to be placed on more than one transplant list, which means you can remain on our transplant list and be dually listed. You can be evaluated by another transplant center and transfer your care without loss of accrued waiting time. You have the right to withdraw agreement for transplantation at any time during the process. UNOS provides a toll-free patient services line to help transplant candidates, recipients, and family members understand organ allocation practices and transplantation data. You may also call this number to discuss a problem that you may be experiencing with your transplant center or the transplantation system in general. Toll-free patient services line is 1-888-894-6361. All patients on the waiting list are required to attend a pre-operative transplant education class. You will learn more about the transplant process, what to expect while you're in the hospital after being called in, and how to take care of your new organ after transplant. Stay as healthy as you can. The healthier you are when you're transplanted, the faster you'll recover, and the better outcomes you'll have. It is your responsibility to keep in touch with your transplant coordinator. Notify us of any telephone, address, or insurance changes. Notify us when you'll be out of town or unavailable to be called in for transplant. Let us know of any changes in your health, if you're hospitalized, or if you're applying for hospice services. You're responsible to keep up with your regular follow-up visits in our transplant clinic, provide your coordinator with any new test results or records that are requested, including yearly radiology exams, mammogram, pap smear, vaccine records. It is very important to keep your vaccines up to date to reduce the risk of transmissible diseases and infections. You are also responsible to update your MELD labs as required to maintain your place on the waiting list. If the labs are not received by the due date, you will automatically drop down to the bottom of the waiting list until we receive your lab results. Please remember that our center will only provide prescription refills for medications prescribed by our providers. Refills take 3 to 4 business days to be approved and called into your pharmacy, so please plan accordingly. For your convenience, the University Health System offers a patient portal where you may view your health information such as lab results, update your personal information, request, reschedule, or cancel appointments, view your account details, and pay your balance online. You may access this site from the UHS main website or go directly to myuhs.com. Once you're placed on the waiting list, be ready to be called in anytime, day or night. Have your cell phone powered on and handy at all times. We may call at unexpected times. Be prepared to leave your house within a few minutes after receiving the call. Have a bag packed at all times with items you'll want to take with you to the hospital. For your comfort, you're encouraged to bring loose-fitting clothing, slippers, a robe, and toiletries. To be sure your family members are prepared, pack clothing and other items they may want while they wait through the surgery and are with you after your surgery. Bring your medications with you. When an organ becomes available, the transplant coordinator only has a short window of time to reach you before the offer must move on to the next patient on the list. For the organ offer to be accepted, you must be prepared for the transplant. We're not allowed to share any donor information with the recipient. We're protecting the donor and the donor's family right to privacy through their agreement for donation. We cannot share age, gender, cause of death, or location of the donor. We request that you respect the donor family's right to privacy and not ask any medical staff any identifying information of the donor. You will be listed as accepting organ offers from increased risk donors. If you're offered an organ from a donor that is considered an increased risk than a standard donor, these risks will be explained to you. You have the right to decline an offer from an increased risk donor without penalty. Donation after circulatory death is the recovery of organs after the blood stops circulating in the body. Split liver is when the donor liver is split in two, and the larger portion goes to an adult and the smaller portion goes to a child on the liver transplant waiting list. If you're hepatitis C positive, you will be placed on the liver transplant waiting list as accepting an organ from hepatitis C positive and hepatitis C NAT positive donor unless you're undergoing or have been treated for hepatitis C. All patients on the liver transplant waiting list will be listed as accepting a hepatitis B core antibody positive organ offer. The physicians of the transplant center have found the occurrence of false positives for this test. Patients who test positive for hepatitis B core antibody will also be listed as accepting hepatitis B NAT positive organ offers. The transplant center has determined the risk of developing hepatitis B is much lower than the risk of death on the waiting list. Hepatitis B treatment will be available to patients who accept this type of organ. It is the patient's responsibility to remain up to date with hepatitis B vaccinations and booster shots. Every kidney offered for a transplant will have a Kidney Donor Profile Index, or KDPI, score, which ranges from 0 to 100%. If you're in the combined liver kidney transplant waiting list, you may be offered a deceased donor kidney with a KDPI score of greater than 85%, which is associated with the kidneys likely to function the shortest amount of time, but is considered a good match for you by the medical team. The Public Health Service Guideline was set in place to improve organ transplant recipient outcomes by reducing the risk of HIV, hepatitis B, and hepatitis C virus transmission, keeping in mind that transplantation can never be free of this risk. A donor will be classified as a PHS increased risk donor if the donor meets one or more of the PHS guideline criteria, which have been provided to you in the combined liver kidney transplant recipient acknowledgement form on pages 3 and 4. Donors on hemodialysis in the preceding 12 months prior to donation will be classified as increased risk for transmitting hepatitis C only. We normally do not accept organs from such donors unless we feel the benefit far outweighs the potential risk. If you choose to accept this organ, you will be monitored for several months so that we can be sure that no transmission occurred. You will be made aware that you are being offered this type of increased risk donor by the on-call nurse or the transplant physician. They will discuss any concerns with you. You may turn down this type of organ offer without penalty. A liver transplant surgery lasts approximately 3 to 6 hours. The average hospital stay is 7 to 10 days, 2 to 3 days in the transplant ICU. Your hospital care will be overseen by the multidisciplinary transplant team. Risks and complications related to transplant include, but are not limited to, rejection. Rejection is one of the highest risks associated with transplant, especially during the first 3 months after transplant. Your immune system will not recognize the transplanted organ and attack it, like it would a bacteria or a virus. There is also a chance that the transplanted organ may not function well immediately or at all because of technical factors or other complications. You will take immunosuppressant or anti-rejection medications for the lifetime of your transplanted organ, which will protect your transplanted organ from your body's immune system. If you do not take your medications properly, you will reject your new liver. If your liver fails because you were not taking your medications properly, you will not be considered for another transplant. The donor organ is thoroughly examined and tested by the organ bank for transmissible diseases. However, there is still a risk that donor-associated tumors, genetic diseases, and/or transmissible diseases, including, but not limited to, HIV, hepatitis C, and hepatitis B, may not be identified until after transplantation and may be transmitted to you. Bleeding that may require a blood transfusion. Complications related to post-transplant medications. The anti-rejection medications weaken your immune system, so you will be at risk for infection and cancer. Respiratory complications. Surgical complications. Diabetes may be caused by drug therapy used to prevent rejection. Your kidneys may be affected by the post-transplant medications or by trauma of the surgery. Psychosocial risks, including financial stressors, caregiver burnout, loss of support, emotional, psychiatric disturbance, which may include guilt, resentment, depression, PTSD, or generalized anxiety. Reinfection of original disease, such as hepatitis B or C, or autoimmune hepatitis, which may recur and may lead to recurrent cirrhosis. These viruses have been shown to be more aggressive after transplant. As with any surgery, there is always a risk of death before, during, and after transplant. The SRTR, which stands for Scientific Registry for Transplant Recipients, is the world's largest transplant database, which analyzes transplant data to determine survival rates among other data to ensure transplantation continues to improve. Copies of updated SRTR data have been provided to you. This data is published every 6 months and is available at www.srtr.org. After it is decided that you're a suitable candidate to start a transplant evaluation, one of our nurses may ask you to volunteer to take part in a research study for transplant medications and liver disease studies. If you decline consent, you will not be penalized. There is a severe and chronic shortage of donor organs. Living liver donation is one solution that has been proven to be successful. A major advantage to living donation is that the transplant can occur before the patient becomes too ill to survive transplantation, or before the onset of life-threatening complications of their liver disease. University Transplant Center is the only living liver donor program in South Texas. When a portion of a healthy liver is removed, the liver grows back to its original size within a short period of time in both the recipient and the donor. A healthy donor can safely donate up to 60% of their liver. A donor may be related or unrelated to the recipient. They must provide documentation of blood type to determine if they're compatible with the blood type of the recipient. They must be in excellent health, be between the ages of 21 to 55 years old, and be at a healthy weight to start an evaluation for living liver donation. A donor may be asked to show proof of health insurance. They must have social support that is separate from the recipient. A donor must complete all evaluation testing and be approved by the Multidisciplinary Selection Committee for donation. All medical expenses related to the donation are covered by the recipient's insurance. The donor's out-of-pocket expenses include travel expenses, food, lodging, daycare, time off work. A donor will need approximately 6 to 8 weeks to recover after donation. Thank you for your attention. If you have any questions, please feel free to call our offices at 210-567-5777 and ask to speak to a liver transplant coordinator.